Oh my gosh, who was our winner? Nick from Keystone. He called in and he won. He answered the correct answer. Dr. Paul's with me right now. Do you have any guess what the answer was to how many speeches in Shakespeare's plays?
How would anyone ever know this?
I actually guessed right. Okay, Nick, 17%.
That's amazing.
He guessed right. He's the winner for that awesome demo day from Christie Sports. There he is, the man himself.
I got a good quote from Shakespeare.
Ooh, what is it?
Nothing is either good or bad, but thinking makes it so. So it's like our perception of whatever happened.
I almost want to write that down. That was good.
Yeah.
Where do you
Shakespeare,
remember that from?
It was from a book called The Power Now. It's cool.
So good. Well, welcome to the show. I'm so glad you're here.
Of course.
And Dr. Paul's from Dillon Ridge Family Dental here in town. And we are going to talk about tooth pain. So tell me, let's start. Let's jump right in. What do we, like, how do we get tooth pain? What causes it?
Yeah, so that's one of the main calls that we get from people will be that they have some pain in their tooth and they need to come in today, right away.
Okay.
It's one of the worst pains that you can have. So preventing it is always going to be great, but the main reason for tooth pain is usually cavities that start small when we're younger and they can grow over a number of years. It actually takes usually years for cavities to form. And so if you haven't been to the dentist for a couple years, 5 years, 10 years, things like that, it can develop faster depending on your diet, but really like cavities will just get bigger and bigger until they start to touch the nerve of the tooth. And once the cavity is touching the nerve of the tooth, that's when people will get that tooth pain and they'll come in right away after that.
So obviously in a perfect world, you don't want your cavities to get that big.
Yeah.
But that you're also saying that's what's causing it. It's not the cavity itself, it's once it starts growing closer
bigger.
to the
Yeah, because cavities themselves, I get that sometimes people will ask, if they have a cavity, they're like, well, I don't have any pain in my tooth. But that's a good thing. If you had pain in your tooth, that'd probably mean you need a root canal. But ultimately, it's just something that we can prevent. The bacteria that are living inside of our mouth, they eat our food. When they eat our food, they produce an acid, and that acid dissolves our tooth structure and makes it soft, and that's what a cavity is. And when those bacteria get close enough to the nerve, they start to travel into the nerve itself. You'll start to feel cold sensitivity is usually the main thing that people will have. Is they'll have some cold water or something like that, and they'll feel like a jolt of pain in their tooth, and that's the first indication that you have a cavity that's gotten pretty big to the point where it may end up needing a root canal.
So I'm sure people watching who could identify with maybe they've experienced that.
Yeah.
How can you prevent this from even happening? Is it
regular totally.
Brushing and flossing, or?
Yeah, brushing, flossing, using a fluoride toothpaste.
Okay.
Flossing is the main one, I would say, actually. If you had a choice between brushing or flossing, and you were on a desert island, bring the floss, because most cavities between the teeth are the ones that get big enough to the point where they end up getting, into the nerve of the tooth. But it's interesting because one of the things that I find is people, so they'll have that cold pain and that could be pretty severe, but then they'll actually still not go. And they'll get to the point where that pain goes away, and they're like, "Oh, it was fine.
Okay.
I'm in the clear.
Yeah.
No problem." The issue with that is that usually when the pain goes away, it means that the nerve actually died in the tooth.
Yikes.
Once the nerve is dead, you don't have any pain because there's no nerve sensation. Then you have what's called like a dead tooth, and then within a matter of months, the bacteria will travel down the center of the tooth and into kind of the bone, down at the bottom of the root, and that's when they cause an abscess, which is like an infection, and the tooth will actually cause like probably 5 or 10 times more pain than that initial episode. You'll be like, and I've seen it all the time where people will have like swelling in their face, You could even end up in the hospital. I've had some patients, I used to work in a hospital, and I would see all those people that would come in and their whole face is like swollen from a tooth.
So as far as tooth pain, what can happen? I mean, we obviously need you on speed dial, but what do you do to treat the tooth pain?
Yeah. So that's a great question. Usually it involves doing a root canal if it's in pain. If we could keep the tooth, and if it's a good like solid tooth, then we'll go ahead and do a root canal. If it's taken out too much of the tooth structure and there's just not much left, then we just take the tooth out at that point. But
it seems like anytime you come in, the key is actually maintaining a good routine.
Yeah, just prevent that all from happening.
Right. I'm glad we have you here in Summit County, so we know where to go if any of this happens. So how do we find you as far as like making an appointment? What's your website?
Yeah, come on in. We're right by the City Market gas station. My wife, she's the front desk, and their employee named Michael. They're incredible. Nice. They'll walk you through, and we'll get you on the schedule. Especially if you're dealing with tooth pain, we will see you the same day because we want to make sure that we could get you out of pain as soon as possible.
Okay, perfect. So this is Dr. Paul, and he's with Dillon Ridge Family Dental, and they're here in Summit County over by City Market. Yeah. So give them a call, make an appointment, and be sure to do all the care that you need to do to stay out of these situations. So stay with us, and thank you so much for coming. We have more to come.